Many PLAB 2 candidates who fail are not unsafe doctors. They are not lacking medical knowledge, and they often leave the exam genuinely surprised by the result. In this video, I want to explain why safe, capable doctors still fail PLAB 2 and why they often don't realize it until after the exam. In the previous videos, we've established 3 important points. Firstly, that PLAB 2 is not a knowledge exam. Second, that examiners can only score what they can observe. And third, that examiner scoring is organized using 3 domains: data gathering, clinical management, and interpersonal skills. Once you understand this, a pattern starts to appear in why candidates lose marks. Failing PLAB 2 is rarely about doing something obviously wrong. It's usually about not making your competence visible. Most doctors work using internal reasoning. You're thinking about differentials, you're assessing risk, you're prioritizing management steps in your head. But PLAB 2 examiners cannot score insight. They cannot score intention, and they cannot score what you meant to say or do. They can only score what you actually say, what you physically do, and how you communicate it. So a candidate may be clinically safe, but if their reasoning, priorities, and safety are not clearly demonstrated, marks are lost across all 3 domains. And this is one of the biggest mismatches between real clinical work and PLAB 2. Let me give you a simple example. 2 candidates see the same patient with chest pain. Both recognize that this could be serious. Both intend to arrange urgent assessment. Candidate A thinks this through internally, asks some relevant questions, and then says, "I would like to arrange further investigations." Candidate B, however, says, "Because this could be cardiac chest pain, my priority is to assess for life-threatening causes. I would like to arrange an urgent ECG, some specific blood tests," and the candidate mentions the blood tests, "start appropriate monitoring, put into place some measures like oxygen, aspirin, etc., and escalate to a senior." Both candidates may be equally safe, but only one of them has made their prioritization and safety thinking clearly observable. So examiners cannot assume what you know. They can only score what you demonstrate. This is why many candidates walk out of stations or walk out of their exams feeling confident. In their head, the reasoning was correct. The diagnosis made sense. The management plan felt appropriate. But when examiners review the performance, they are marking what was shown, not what was thought about. And because PLAB 2 uses domain-based scoring, small gaps across multiple domains add up very quickly. And this is how capable doctors end up with borderline or failing scores without ever realizing where the marks were lost. This problem is often reinforced during practice. Candidates practice with peers who understand their thinking, and the feedback they receive is often vague. "That seemed fine. You covered everything. You did very well." But clarity, structure, and visibility are rarely challenged in this kind of practice. So their confidence might improve, but their exam performance doesn't. PLAB 2 is not designed to test whether you are safe in your head. It rewards safe practice that is clearly demonstrated. If your competence stays internal, examiners cannot score it. Most PLAB 2 candidates think they fail stations because of knowledge gaps. That's rarely the real reason. What actually fails candidates is how they present information under pressure and how examiners interpret that behavior across all three domains. I'm running a live masterclass this week where I break down exactly how examiners score candidates, the patterns they penalize repeatedly, and how strong candidates think and perform during stations. This isn't for people who just want tips or reassurance. It's for candidates who want to understand how the exam really works. If that's you, the link is below.